I'm Dr. Michelle Eller, and I'm a cosmetic physician here at Reflections, and today we're here to talk about dark circles under your eyes. So right now, just so you don't miss what's going on here, just like our YouTube channel, follow our videos. You can click right up in the right-hand corner, and any questions or comments you can leave below and we'll get back to you. So dark circles are caused by a number of different things depending on your age, your genetics. So there is the skin component. There can be hyperpigmentation to the skin. There can be some crepiness to the skin. Some laxity to the skin. There is some hollowness that we have to contend with on some patients where they have a more scooped out appearance. There's also fat pads that we need to look at. Some people get fat pads here and some fullness here called festoons. We have to work around those too. Also, people don't realize that the fullness of your cheeks can affect the appearance of your under eyes. So many of these different components have to be corrected depending on what you personally have in order to give you the best under eye appearance. So when you come in for a consultation, we have to look at each individual patient because everyone's under eyes are just a little bit different. So if you have just hollowness, as many young people primarily do, fillers are really the way to go. So fillers can actually create some more brightness. Some people come in and they say I have dark under eyes, but what they really mean is it looks like it's looking into a dark cave and it looks very dark under their eyes because it's sunken in. So if we put some fillers in, our primary fillers being Restylane, Restylane Silk, Belotero, as they absorb a little less water and they're very good under eye fillers, we can bring that, make this more flush, make this under eye blend with your cheek, and it looks instantly brighter just by creating a flatter appearance under the eyes that is not as sunken in. If you have fat pads, we can do some contouring around them and disguise the appearance of them. True correction of a fat pad would be the removal, but we can make them look a little less prominent if that's something you don't want to have to deal with or they're very minimal. Next, we would look at the under eye skin texture. So depending on how severe the issue is, we can do something very simple like a radiofrequency wand, like an iFine or a ThermiSmooth are two of our options that we have here. They can create some heat stimulation of collagen, and that can tighten up a little bit of that crepey skin, create a little thickness, help disguise the appearance of the pinkness, which is actually your muscle, or some of the lighter blue veins under your eyes, and makes it look a little brighter just by not having that darkened appearance. If you have very crepey under eyes or more excess skin, if it's a lot of excess skin, it would have to be surgically removed, but if it's a little bit, we can use a more aggressive laser with some nanofat. That's a little bit more involved. That's going to have a little more downtime to it, but has very dramatic results. This is more for the older set, maybe 60 plus, who have more kind of going on under their eyes. With cheeks, we have to address the mid-face as a primary concern. So cheeks, a lot of times, if we fix them, you can get some lifting effect, and the outside corners of the eyes themselves can really look rejuvenated, replacing kind of where that fat has kind of become sallow. Also, people will point here, they have this, and if you fill this in, it can make the under eyes just look less drawn out and that sad puppy kind of look. So a lot of people come in and they have darkness under their eyes, and some people, like we talked about, it will be fillers that will correct that. It's from hollowness, but some people are genetically predisposed to have excess pigment under their eyes. It's nothing, there's nothing you can do to have prevented this in the past, but there's some things we can do to help it now. Hydroquinone is one product where it helps actually suppress the pigment production at the cellular level. That's something you use at home in addition to doing some use with lasers. We can use some different lasers to help break up that pigment, to give you a little bit brighter complexion under your eyes, to not have that darkness that you were born with and are genetically predisposed to have. There is some other techniques we can use when you have somewhere in between a ThermiSmooth under eye and a CO2 under eye. So when you're starting to get a little more crepiness and you're not liking what you're seeing, we can do something called radiofrequency microneedling. What that does is it's a microneedling needle. It has heated tips on it and creates a double injury. So what we're doing is injuring by creating little micro holes, and at those base of those holes, we're creating little heat injury. That will help build collagen. We use the same technology in other areas of the face, but we can also use it under the eyes. So many people come in, they have little blue veins under their eyes. Depending on the size of the vessel, if it's small, we can actually pick it off with a little tiny laser. Just a little snap, it'll help collapse that little vessel shut and eliminate that kind of blue undertoned area. It's kind of a nice finishing touch to some of the other things that we were doing to rejuvenate the under eye. So I think the best way for you to know what you need as a patient is for you to come in and have a free consultation. We'll go over each individual area that is creating your under eye appearance and how to correct it. A lot of times we can come up with a plan where you can do all of these treatments same day in the office and really have a wonderful way to have a nice rejuvenated appearance under your eyes. So we look forward to meeting you and going over a plan to make you look like the best version of you.